Signals come and signals go, representing ion flow. Starts up top at the SA node and heads on down a conduction road. The AV node then get a chance to slow things down as atria dance. Then things flow on without a miss, as next we see the bundle of hiss. Then bundle branches give the ventricles chances to make sure that myocardium dances. To make sure that myocardium dances.
Hey guys, this video is just going to cover off a little bit about the conduction system of the heart itself so that we can contextualize that PQRST and understand sort of where it's all coming from. It's important to know a little bit about the anatomy and how that functions. Might be a review to a lot of you, but I thought I'd just go along with it. We'll have a short video on the conduction system. So let's get to it. First of all, here's an image of the heart. Now, I'm not going to lie to you, it's not a good image of the heart. In fact, I'd argue it actually looks a lot like the spaghetti squash of learning. So just take it for what it is. Granted, the atria are potentially having a little bit of a problem here because they look pretty big, but let's just keep in mind and go with me on this, that we have the right atrium and the right ventricle and the left atrium and the left ventricle represented here, but we're just going to talk about the conduction system. So the first thing I want to talk about is what's called the sinoatrial node, or the SA node. And the SA node sits in the right atrium, pretty close to where the vena cava come into the atrium, and it's a specialized group of cells that has what we call automaticity. What that means is that they automatically fire off. In the sinoatrial node, usually that rate is different in everybody, but somewhere between 60 and 100 beats per minute. This is the pacemaker part of the heart, the inherent part that keeps our heart going all the time and kicks off the P wave. So the sinoatrial node depolarizes on its own and then kicks off a wave of depolarization throughout the heart at 60 to 100 times a minute, depending on the person. When that depolarization happens, it's going to spread throughout the atria, and it'll spread throughout the atria throughout all of the muscle to cause contraction, but there can be some specific little actual routes that it takes to get down to the next node down here. And this is a bit different in everybody. And there's also a branch that goes off to the left atrium here, which I believe is called the Bachman's branch or bundle sometimes. And the names aren't really important, but there are some sort of little mini highways or roadways that this signal takes to get down to this node, but at the same time it's going to depolarize all of the atria. The next thing we get to after this wave of depolarization comes is we get to the AV node, or the atrioventricular node, which isn't a very good name, but that's all right, that's what it's called. So the atrioventricular node is where all of these signals go and they come to this AV node, which induces a little bit of a pause in the whole cardiac cycle. And this is represented by the PR interval. And that little bit of a pause is important because that's what gives the atria time to actually squish and get the blood from the atria down into the ventricles. So we need that pause to make sure that that atrial blood is getting into the ventricles. The AV node itself also has automaticity, but it doesn't depolarize as quickly as the sinoatrial node. Whereas a sinoatrial node might depolarize at 60, 70, 80, 90 beats a minute in somebody, the AV node will depolarize more slowly at a rate of about 40 to 60. Because the sinoatrial node kicks off things more frequently, the inherent automaticity, or the desire for the AV node to fire, is suppressed by the fact that it's getting stimulation from the SA node down through the atria. So it doesn't actually really need to do anything. It's just kind of doing what the SA node tells it to, until we get to a disease state. And we'll talk about this automaticity as we talk about the different types of heart blocks and whatnot. From the AV node, there's another little part right here that's called the bundle of His, which sits right here. And the bundle of His is an extension of the AV node, but it basically starts the formation of these two branches right here. And this is called the left bundle branch right here, and the right bundle branch. And these are just a continuation of the highway of electrical stimulation as it flows down through the heart. And these bundle branches transmit the signal very quickly and also form, once we get into the ventricles, the bulk of what we're seeing in the QRS complex here. When the depolarization fires down, again, it goes very quickly. It goes down the right bundle branch, mostly to the inferior part of the heart and the right side, and then down the left bundle branch through the septum into the left side of the heart. There's also these little parts in here because there's actually a little posterior part of the left bundle branch called the posterior fascicle, if you're looking it up. And that sort of goes around the back more so and to the outside of the left ventricle and to the other side of the papillary muscles as well, versus the anterior fascicle right here. And the anterior fascicle comes down to the bottom of the heart in the apex and to the rest of the ventricle. And this also becomes relevant because these things can all have inherent blocks in them, or they can have little pauses due to ischemia or disease or whatever. And we can see this on the ECG, and we'll get into this when we talk more about the types of heart blocks. Now, all of the conduction system down here in the ventricles also has what's the automaticity or inherent automaticity. But just like how this one at 40 to 60 a minute is less than this one, so it gets overridden, the same thing occurs down here where these things have an inherent automaticity of maybe 20 to 40, so very slow. So that also gets overridden. As long as everything's going fine, they don't really need to do any of that stuff. What happens is when there's a block and they don't get any signal, that's when these guys are like, what up? I didn't get any signal. So their inherent automaticity takes over and starts to fire, but it does it at a lower rate. And the result of that is you end up with a bradycardic patient. And we'll, like I said, we'll dig into that more with the blocks because it's interesting to look at it and to start to link it to the mechanical effects and what's going on with our patient who's bradycardic. So the last thing to discuss is there's little Purkinje fibers, which are little sort of like, if these are the highways, those are just sort of the roads that are dividing out and spreading that signal to the ventricles and to the muscle mass to get that squeeze. It's also very coordinated because we want the heart to squeeze in a certain way to maximize the amount of blood that it squishes out for the amount of effort that it puts in, right? That sort of makes inherent sense. And what happens is you'll actually see that that spreads nicely from the endocardium to the epicardium to coordinate that squeeze so that the net benefit tends to be where you're getting all of this going this way, and then it loops around in 3D and basically accounts for all of that QR and then the S at the end of it, which we'll talk about. So just to quickly review, sinoatrial node is going to fire off. That's most of our beat. Goes through different pathways in all the atrium to the AV node to the bundle of His, through to the right and left bundle branches. And the left bundle branch has the posterior and anterior fascicles. And then there's the Purkinje system that helps spread that signal around to make those ventricles go. So that's just a quick overview. Lots of good resources out there, and I'll include some more as well. But that's it. Now you kind of have a good framework to understand the PQRST and the normal firing, and we will get into the fun stuff.
Next we see the bundle of His and bundle branches. Give the ventricles chances to make sure that